Have you or someone you know had a heart stent placed recently? Have you ever wondered how long that stent will actually last, or if it provides a permanent solution to heart health issues? Many people, especially those over 60, might believe that once a stent is implanted, it will last a lifetime without any further concerns. However, the reality is more nuanced, and understanding the lifespan of a heart stent is crucial for managing your health effectively. Now, before you start worrying, let me reassure you, having a heart stent does not mean you have to live in constant fear of it failing. In my experience, understanding the facts about stents can empower you to take proactive steps in maintaining your heart health. You are not alone in this journey, and today, I am here to guide you through the complexities of heart stents with clarity and compassion. Throughout this video, I will break down the lifespan of modern heart stents and discuss the various factors that can influence their longevity. I will also share some practical lifestyle habits that can help in extending the life of your stent. You will discover why some stents may fail earlier than expected and how you can minimize the chances of that happening. Additionally, I will delve into the differences between bare metal stents and drug-eluting stents, so you have a comprehensive understanding of your treatment options. Before we dive deeper, make sure to subscribe to this channel, activate the notification bell, and give this video a thumbs up. By doing so, you'll stay updated with more expert-backed insights into heart health that are tailored just for you. Now, let's explore the fascinating world of heart stents together. The journey of understanding heart stents begins with recognizing the types of stents available and their intended purpose. Heart stents are tiny tubes inserted into your coronary arteries to keep them open and ensure proper blood flow to the heart. They are often used after procedures like angioplasty, where a balloon is used to widen narrowed arteries. While stents significantly improve blood flow and reduce the risk of heart attacks, they are not a cure for coronary artery disease. Let's start with the modern drug-eluting stents. These stents are coated with medication that is slowly released to prevent the artery from becoming blocked again, a process known as restenosis. In the past, bare metal stents were the norm, but they had a higher chance of restenosis as they lacked this drug-releasing capability. Drug-eluting stents have revolutionized the treatment by significantly reducing the risk of blockages forming again. However, they are not without their challenges. A common misconception is that once a stent is placed, it will last forever. In reality, the lifespan of a stent can vary based on several factors, including your lifestyle and overall health. Generally, drug-eluting stents have a good track record for durability, often lasting for many years. Yet studies have shown that after 5 to 10 years, some patients may experience issues. It's essential to stay informed and proactive about your heart health to maximize the effectiveness of your stent. To illustrate, let's consider the story of John, a 65-year-old retiree who had a drug-eluting stent placed after a mild heart attack. John was under the impression that the stent was a permanent fix. However, after a routine checkup 5 years later, his doctor discovered that the artery was narrowing again. This scenario, though concerning, is not uncommon. It highlights the importance of regular follow-up appointments and the role of lifestyle in stent longevity. Speaking of lifestyle, let's delve into some practical tips that can extend the life of your stent. First and foremost, maintaining a heart-healthy diet is crucial. This means consuming a variety of fruits, vegetables, whole grains, and lean proteins while minimizing saturated fats, salt, and sugar. For example, instead of reaching for a bag of chips, consider snacking on a handful of nuts or a piece of fruit. A balanced diet not only supports your overall health, but also helps in preventing further blockages in your arteries. Exercise is another vital component in ensuring your stent lasts as long as possible. Regular physical activity strengthens the heart muscle, improves circulation, and aids in maintaining a healthy weight. It doesn't mean you have to run marathons. Even a daily walk around your neighborhood can make a significant difference. In fact, studies have shown that people who engage in moderate exercise after receiving a stent tend to have better outcomes than those who remain sedentary. Managing stress is equally important. Chronic stress can have a detrimental impact on your heart health, potentially affecting the longevity of your stent. Techniques such as meditation, deep breathing exercises, or even engaging in hobbies you enjoy can reduce stress levels. Consider Mary, a 72-year-old woman who found solace in gardening after her stent placement. Not only did gardening provide her with moderate physical activity, but it also served as a calming ritual that helped her manage stress effectively. Another critical aspect is adherence to prescribed medications. After receiving a stent, your doctor will likely prescribe medications to prevent blood clots and reduce cholesterol levels. It is paramount to take these medications as directed without skipping doses. Failure to do so can increase the risk of stent failure and other complications. Preventive measures such as quitting smoking cannot be overstated. Smoking is one of the most significant risk factors for heart disease and can drastically reduce the lifespan of your stent. If you are a smoker, seeking resources and support to quit can have a profound impact on your heart health. Remember, it's never too late to make positive changes. Now, you might be wondering about the potential for stent failure despite following these recommendations. While no medical procedure is without risk, understanding the signs of potential issues can help you seek timely medical advice. Symptoms like chest pain, shortness of breath, or unusual fatigue should not be ignored and warrant prompt attention from your healthcare provider. In summary, while heart stents are highly effective in treating coronary artery issues, they are not a permanent fix. The lifespan of a stent depends on various factors, including the type of stent, your lifestyle, and adherence to medical advice. By embracing a heart-healthy lifestyle and staying vigilant about your health, you can significantly enhance the longevity of your stent and enjoy a more active, fulfilling life. As we continue this journey together, there's much more to uncover about the intricacies of heart stents and how you can take control of your heart health. Stay tuned as we delve deeper into the research and strategies that can further empower you on this path. Now, let's explore some of the pivotal factors that can influence how long your heart stent will last. It's important to recognize that even though a stent is a marvel of medical technology, its longevity isn't solely dependent on the device itself. Rather, it's a dance between the stent and the choices we make every day. Firstly, let's talk about the type of stent you have. There are two primary types of stents: bare metal stents and drug-eluting stents. Each has its own characteristics and benefits. Bare metal stents are the original iteration. They're essentially tiny metal meshes that provide a scaffolding to keep your blood vessel open. They are effective, but they have a higher rate of restenosis, which is when the artery narrows again. Drug-eluting stents, on the other hand, release medication over time that prevents the artery from becoming blocked again. These tend to have a longer lifespan because they actively work to reduce the risk of restenosis. Studies have shown that drug-eluting stents can significantly lower the chances of needing another procedure. However, even with the best stent technology, lifestyle factors play a crucial role in stent longevity. Let's dive into some specific lifestyle habits that can make a significant difference. One of the most important steps you can take is to quit smoking. Smoking is a major risk factor for coronary artery disease and can severely impact the lifespan of your stent. It causes inflammation and damage to your blood vessels, which can lead to restenosis. Quitting smoking can be challenging, but there are numerous resources available, including nicotine replacement therapies, counseling, and support groups. Consider reaching out to your healthcare provider to discuss a tailored plan to help you quit. Another vital factor is maintaining a heart-healthy diet. This means focusing on foods that are low in saturated fats, trans fats, cholesterol, and sodium. Incorporating plenty of fruits, vegetables, whole grains, and lean proteins into your diet can help keep your arteries clear and reduce the risk of further heart complications. For example, try swapping red meat for fish rich in omega-3 fatty acids, like salmon or mackerel, which are known to support heart health. Exercise is another cornerstone of keeping your heart and stent healthy. Regular physical activity helps improve blood circulation, reduce blood pressure, and manage weight. Aim for at least 150 minutes of moderate aerobic exercise per week, such as brisk walking, swimming, or cycling. Remember to consult with your doctor before starting any new exercise regimen, especially if you've recently had a stent placed. They can provide guidance on what activities are safe and suitable for you. Managing stress is equally crucial. Chronic stress can lead to high blood pressure and other heart health issues. Consider incorporating stress-reducing activities into your daily routine. Practices like yoga, meditation, or even simple breathing exercises can help lower stress levels and improve overall well-being. For instance, try setting aside a few minutes each day for deep breathing exercises. Inhale slowly through your nose, hold your breath for a moment, and then exhale slowly through your mouth. This can help calm your mind and reduce tension. Adhering to your prescribed medication regimen is another critical component. After receiving a stent, your doctor will likely prescribe antiplatelet medications to prevent blood clots. It is essential to take these medications exactly as prescribed and not stop them without consulting your healthcare provider. Missing doses or stopping medication can increase the risk of stent thrombosis, a serious and potentially life-threatening complication. If you ever experience side effects or have concerns about your medication, don't hesitate to reach out to your doctor to discuss alternatives or adjustments. Regular follow-up appointments with your healthcare provider are also vital. These visits allow your doctor to monitor your heart health, assess how well your stent is functioning, and make any necessary adjustments to your treatment plan. During these appointments, be sure to discuss any new symptoms or concerns you may have. This proactive approach can help catch any potential issues early and ensure that your stent continues to perform optimally. Now, let me share a few real-life examples to illustrate how these lifestyle changes can make a difference. Take the case of Mary, a 70-year-old woman who received a drug-eluting stent 5 years ago. Mary was a smoker and had a diet high in saturated fats. After her procedure, she decided to make some changes. She joined a smoking cessation program and gradually replaced unhealthy foods with fruits and vegetables. She also started walking for 30 minutes each day. Today, Mary is enjoying a vibrant life, free from symptoms, and her follow-up exams show that her stent is functioning well. Then there's John, a 65-year-old man who had a bare metal stent placed due to a blocked artery. John was initially hesitant to change his lifestyle, but after attending a cardiac rehabilitation program, he learned the importance of exercise and stress management. He began practicing yoga and found it helped reduce his anxiety levels. John also takes his medications diligently and regularly visits his cardiologist. As a result, he's seen significant improvements in his overall heart health. Lastly, consider the story of Robert, a 72-year-old who faced complications after his stent procedure. Robert struggled with medication adherence, which led to a near-fatal stent thrombosis. This experience was a wake-up call for him, and with the help of his healthcare team, he developed a system to remember his medications. He uses a pill organizer and sets reminders on his phone. Since then, Robert has not only maintained his heart health, but also feels more in control of his treatment. These examples highlight the power of taking charge of your health. It's never too late to make positive changes. To wrap up this segment, let's recap some practical tips to help your stent last longer. 1. Quit smoking and consider seeking support from your healthcare provider if needed. 2. Adopt a diet rich in fruits, vegetables, whole grains, and lean proteins, and limit your intake of saturated fats and sodium. 3. Engage in regular physical activity, but always consult your doctor before starting any new exercise routine. 4. Incorporate stress-reducing activities such as meditation or yoga into your daily routine. 5. Take your medications exactly as prescribed and communicate openly with your healthcare provider about any concerns. And 6. Attend all scheduled follow-up appointments to ensure your heart health is on the right track. By implementing these strategies, you are not only enhancing the longevity of your stent, but also investing in your overall well-being. Remember, you have the power to influence your heart health with the choices you make every day. To truly optimize the lifespan of your heart stent and enhance your overall heart health, it's essential to focus on a comprehensive, multifaceted approach. The strategies I'm about to share are grounded in both medical research and practical experience, ensuring you can apply them effectively in your daily life to maximize your heart's health and the longevity of your stent. First and foremost, maintaining a heart-healthy diet is crucial. This means prioritizing foods that are low in saturated fat, trans fats, cholesterol, and sodium. Think of a diet rich in fruits, vegetables, whole grains, and lean proteins like fish or poultry. These foods help to reduce the risk of plaque buildup in your arteries, which can lead to blockages and impact the efficacy of your stent. For instance, incorporating more omega-3 fatty acids found in fish like salmon or mackerel can be particularly beneficial. These fats help reduce inflammation and improve heart health. If you're not a fan of fish, walnuts and flax seeds are excellent plant-based alternatives. In addition to diet, regular physical activity plays a pivotal role in keeping your heart and stent in good condition. Aim for at least 30 minutes of moderate exercise on most days of the week. This could be a brisk walk, cycling, or even gentle swimming. Physical activity helps to improve blood circulation, lower blood pressure, and maintain a healthy weight, all of which are vital for keeping your arteries clear and your stent functioning well. If mobility is a concern, consider chair exercises or water aerobics, which are excellent low-impact options. Another key factor is managing stress. Chronic stress can negatively affect your heart health by raising blood pressure and causing inflammation. Techniques such as mindfulness meditation, deep breathing exercises, and yoga can be incredibly effective in managing stress. Even setting aside a few minutes each day to focus on your breath and clear your mind can have profound effects on your overall well-being. Additionally, engaging in hobbies or activities that bring you joy and relaxation is just as important. Whether it's gardening, painting, or spending time with loved ones, these activities can help lower stress levels and improve heart health. Quitting smoking is also non-negotiable. Smoking is one of the most significant risk factors for heart disease and can greatly reduce the lifespan of your stent. If you're struggling to quit, there are numerous resources available, including counseling, support groups, and medications that can assist you. Speak to your healthcare provider about the best approach for your situation. Remember, it's never too late to quit, and the benefits to your heart health are immense. Regular checkups with your healthcare provider are equally important. These visits are an opportunity to monitor your heart health, manage any medications you might be taking, and make adjustments to your treatment plan as needed. Your doctor can perform tests to ensure your stent is functioning properly and address any concerns you may have. Don't hesitate to ask questions during these appointments. Being informed about your health empowers you to make better decisions and take proactive steps in your care plan. Medication adherence is another critical component. If your doctor has prescribed medications such as antiplatelet drugs to prevent blood clots, it is vital to take them exactly as directed. Skipping doses or discontinuing use without consulting your doctor can increase the risk of complications. If you're experiencing side effects, don't stop taking your medication. Instead, discuss these with your healthcare provider to find a suitable solution. It's also important to be aware of the signs of potential problems with your stent. Symptoms such as chest pain, shortness of breath, or unusual fatigue should not be ignored. If you experience any of these, seek medical attention promptly. Early intervention can prevent more serious complications and ensure your stent continues to function as intended. Lastly, staying informed and educated about your condition is empowering. Attend workshops, join support groups, or participate in online forums to connect with others who have similar experiences. Sharing knowledge and experiences can provide comfort, encouragement, and valuable insights into managing life with a stent. Now, let's summarize these key takeaways. A heart-healthy lifestyle is essential for maximizing the lifespan of your stent. This includes a balanced diet, regular exercise, stress management, quitting smoking, adherence to medical advice, and regular checkups. Being proactive and informed about your health ensures not only a longer-lasting stent, but also a better quality of life. If you found this video helpful, please support us with a super thanks. Your support helps us create more valuable content for you. Subscribe and hit the bell to receive weekly tips on how to live your healthiest life. Like this video to let us know you enjoyed it and keep yourself informed and empowered.